Jonathon Lavelle, an orthopaedic surgeon and one of the founder members of Fortius. My father was a surgeon. It very much appealed, and I liked the fact that it was a profession where you could do something for people and you were dealing with people. So Fortius initially started as an idea of creating an environment of high quality care using a friends and family type approach, which was that everybody we should have working with us would be the people we would turn to for the various different areas of orthopaedics that we were after. So SCORES stands for Study of Clinical Outcomes, Recording and Evaluation. SCORES is a system that we use to record data and to look at outcomes. It's a fundamental in terms of the care that we provide, that we know that we're actually getting very good outcomes at the end of any treatment. Even more importantly, that if there are treatments that are not effective, that we know that as soon as we can. We've been collecting SCORES since 2012. Since then we've collected an enormous amount of data, and analysis goes on week, year on year of that data. So SCORES starts before any treatment begins and then continues during the course of that treatment pathway until the end of that treatment, or indeed for some of the orthopaedic conditions for many years, to make sure that the outcomes are satisfactory. Fortius have been very much at the forefront of data collection. It's been one of the premises on which all of our scientific and knowledge has been based of treatments, and so we've been doing it for a long time and ahead of most organisations. It's very important that we collect data, both for patients' benefit, to work out that treatments we're giving are exactly the right ones we should be and what actually they're leading to, but also on an economic basis. We don't want treatments that are economically unviable or not having satisfactory outcomes, and the only way of actually finding out satisfactory outcomes is from collecting data. We don't require you to fill in the forms. They don't have to be done, but if we can get as near 100% as possible, then the more accurate the results. Data protection is enormously important to us. It's become very much more obvious to everyone that data sharing is an issue, and we do everything we can to keep data protected. All the information collected is confidential. The more people that answer the questionnaires, better the information we get, the more accurate it is. So we just encourage anybody who can to help us and to fill in the forms. We use the data collected on each individual condition and each individual treatment. We can pull together the aggregated figures of treatments, and the more patients that we have in each group, the more accurate and the more information we get about the results of the treatments, to look at whether there are any variations, and early on we get an idea as to whether treatments are working or not. So the more patients we have in any pathway, the more accurate we can get for the data that we're collecting.